Hey, Dr. Marshall again with Powdersville Wellness. So another question I get is pregnancy. Should women get adjusted while they're pregnant? When should they get adjusted? If you've had chiropractic care your entire life and then all of a sudden you get pregnant, do you stop? Absolutely not. We can still take care of you, and actually it's very beneficial for you and the baby growing to get chiropractic care. Now, are we going to do the same types of adjustments? No, because obviously you have something growing right here. So you don't want to be putting a lot of pressure in there on the abdomen pressure. You don't do a lot of the drops in the lumbar region, but we do focus on the hips and a lot of times the sacrum, because the sacrum is the key to that area, and you want to open up that area to take pressure off. Now, initially when you're first trimester, you might be going through a lot of pain, but it can still be beneficial to you to take stress off of your spine so that you can focus your energy and the flow of information from your body to the baby to get that health to it. Now, obviously, you focus on nutrition and exercise and wellness as well, but you can take the stress off the sacrum, take the stress off the hips and pelvis, which helps open up the space for the baby. That helps the mama with pain. And also, you want to, take care of that throughout the pregnancy. Now, most of the time I recommend ladies get adjusted once a month until you hit about the 34th week, and then I want you to come in once a week. Now, there's also evidence and there's data suggesting and shows, and also, data I've had with pregnancy as well, is if the baby's breech, you can do adjustments, you can do procedures to help turn the baby so the head is face down. Now, typically, that's not going to happen near the end of the pregnancy, so you want to kind of have that information early on, so then you can start doing those things, opening up the space, taking the stress off mama, so that baby does get in the right position. Now, is it always going to happen that way? If there's a breech baby, can you flip it? No. I'm not saying that. There's no data really to support that, but in my experience, I've had a few ladies have been in the breech position, and we knew that early on, and we took special steps and did the chiropractic care, and the baby turned. Baby's always going to be in the right position. You just got to set the environment of the mother and taking the stress off her to do that. Now, does that mean it always happens? No, there are always instances where there may be C-section, or there needs a complication arises where they're going to have surgery. But if you set them up early and get the body in the position it needs to be in, you take the stress off of the mom, off of her spine, that's going to create a better environment for the child to thrive, and then mama to be comfortable, and then have a better pregnancy.